Hi there. Today I'd like to present to you part 3 in the series of Managing Depression on the power of physical activity. An Australian study published in the American Journal of Psychiatry indicated that 12% of depression cases could be prevented if people got just 1 hour of exercise each week. The combined physical and social benefits of exercise are likely responsible for its ability to help prevent depression. Exercise does not have to be intense. There are mental health benefits regardless of whether an individual works out to the point of exhaustion or barely breaks a sweat. There is plenty of evidence that has shown many different forms of physical activity, such as aerobic exercise, cardio, and yoga, can improve depressive symptoms. By increasing blood flow to the brain, exercise can create new brain cells and, like aerobics, trigger the release of endorphins. The most effective public health measures are those that encourage increased levels of everyday activities, such as walking or cycling. Strength training. According to a review of more than 30 published studies, strength training can have unexpected benefits. Resistance exercise training, or RET, is associated with a significant reduction in depressive symptoms and comes with physical benefits, such as strengthening bones and building muscle mass. The effects of resistance training showed improvements in symptoms such as low mood, a loss of interest in activities, and feelings of worthlessness. Strength training, lifting weights, and stretching, or a heavy workout, gets the heart, respiration, and sweat glands going. It also can desensitize the body to certain types of emotional stressors. The American College of Sports Medicine guidelines recommends that an individual perform 8 to 12 repetitions of 8 to 10 different strength-building exercises at least 2 days a week. Lifting weights may not be enough to wipe out depression entirely, but according to a new review, there is evidence that it can be a powerful tool for improving mental health. Aerobic exercises. The American College of Sports Medicine defines aerobic exercise as an activity that is rhythmic, can be maintained continuously, and uses large muscle groups. Examples of aerobic exercises include swimming, biking, jogging, hiking, and skiing. Physical processes that link aerobics and mood improvement are well established. Studies have found that regular aerobic exercise increases serotonin and dopamine levels in the brain. Serotonin and norepinephrine and dopamine are chemical substances known as neurotransmitters that make up the monoamine system and help mediate physiological and homeostatic functions, including mood. Studies conducted in 2008 and 2011 showed that aerobic exercise can, in effect, desensitize the body to certain kinds of emotional distress. Aerobic exercise has been found to have a positive impact on memory, cognition, and mental health outcomes. Yoga. Yoga is a practice that supports physical and mental health and may help alleviate feelings of stress, anxiety, and depression. In the United States and Canada, yoga typically incorporates physical postures, breathing techniques, and meditation. Further controlled studies are needed to determine if and how yoga may improve mental health outcomes. However, research has found that engaging in regular yoga practice, such as 60 minutes of yoga 3 days per week, can reduce feelings of stress, anxiety, and depression. How exercise affects mental health and brain health. Exercise can improve outcomes for individuals with brain and mental health conditions, benefit mood and self-esteem, and support the body's stress response. In a 2019, the World Health Organization highlighted possible psychological and biological factors. Specifically, incorporating exercise into your routine may increase self-confidence, self-control, and stress resistance. Exercise also facilitates neurogenesis, which is how neurons are created in the brain, and increases the production of serotonin and dopamine, like we reviewed earlier in this information, and important neurotransmitters that may be low in individuals with certain mental health conditions. Because exercise exposes individuals with anxiety to physiological reactions that are similar to anxiety, for example, increased heart rate, it's hypothesized that it increases an individual's tolerance and helps them view these symptoms as less of a threat. Tips to stay on track with an exercise routine. Perhaps you enjoy hiking in nature with friends, shooting hoops at the local basketball court with your child, or swimming laps solo. Choosing a type of exercise that you enjoy will encourage you to stay motivated and on track. Whatever type of exercise you choose, make sure that you feel good doing it and you're having some fun along the way. Setting a realistic exercise goal for yourself can be a great motivator. Set small, measurable goals that are attainable and consider applying the SMART goal-setting principles. Staying hydrated and eating nutrient-dense food is important as it provides the energy necessary to exercise effectively and recover post-workout. Nutritional supplements can also be beneficial in these areas. Consult with your healthcare practitioner before starting a new exercise routine. They can offer ideas about what type of exercise might suit your needs, the pace at which to begin, and support and encouragement along the way. Exercise at a time that is convenient to you and gives you the necessary amount of time to finish your workout. For some, this is the first thing in the morning, while for others, it could be during lunch or after work. I do hope you enjoyed this presentation that I gave you today on physical activity. And as always, if you found this information useful, kindly hit the like button and subscribe to my YouTube channel. Until next time, take care and thanks for watching.